Well, we're back with Dr. Preece, the dentist in Alaska up there. So, Dr. Preece, I think one of the most, the feared thing is the needle. I mean, needles are just, even though we know they don't quite hurt as much anymore as they used to and all that type of stuff, and after we survive the needle shot, be it in the butt or be it in the mouth, we're okay with it, but for some reason we have an aversion towards it. Where is this technology? Is there anything out there? How does this shooting the patient up these days go? What's out there? How hurting is it?
Well, we've made progress in helping the injections be more painless. One thing that is available now that's been a real godsend is a technology called Computerized Anesthesia. It's a little box called the wand. And basically, the most of the pain from an anesthetic injection comes because the fluid from the anesthetic goes in too fast, and it causes pressure, causes the tissue to balloon and have pressure. So the idea is if you put it in slowly enough, just a drop at a time, it has a chance to numb as it goes, and also it doesn't cause the tissue to get any pressure, have any pressure. So this computerized anesthetic, it still uses a needle, but by using topical anesthetic first, that very initial poke is very tolerable, hardly feel it at all. And then after that, each drop numbs as it goes and just makes the anesthetic injection very painless, very painless. I really was a skeptic at first, but when I first got the machine, the instrument, I noticed that if we could give, we were able to give children injections even in the roof of their mouth without it hurting and without them crying. And that was what sold me on the technology, that it really was working and was a benefit to people.
So basically, the injection, the needle, and the whatever is hooked up to a computer who pushes it in very, very smooth, computerized, and can proportion it, can basically make it slower than you can with your finger, no matter how. Because I've noticed dentists try to do it slow, and also I've noticed that some dentists, they just zoom and they go faster. And yes, it's you feel like somebody just puts too much stuff into it, somewhere. So that computer makes it super slow, and it's hooked up to a little machine which does that.
Yes, it's basically a little pump, but it's controlled by a computer chip that allows it to go very, very slow, just a drop at a time. And no matter how slowly the dentist tries, I don't think he can do it quite as slow as this machine. And so that's what makes the difference.
Wow. Wonderful. So the technology definitely, does have its advantages. It does make life more comfortable in many places, I think, if used correctly. Huh?
Exactly.
That's wonderful. Well, all right. So here you have it. Even injections is computer controlled, and by doing so, is better. So it's basically they're shooting it in too fast. In the old days, of course, it was the needle. I remember when I was a kid, those needles, they were like a pencil sharpener, They were like, those were like a pipe, a 2-inch pipe going into your.
At least that's what they seem like. Yeah.
That's what they seemed like, but now they're super, super thin, super, super long. So that, as you said, and with being the gum numbed before, that's usually not the problem. The problem is afterwards pushing it in too fast, and that can now be controlled with a computer.
Yes. Yep.
Good. And you have that machine.
Yes.
Wonderful. Again, thanks a lot. Very informative, Dr. Preece, very informative.
Okay, thank you.